Well, good evening, everyone. This is Dennis Stone. I'm the director of the Center for Advocacy and Social Justice at the Jacksonville Urban League. The Jacksonville Urban League has been conducting these monthly conversations about racial healing and reconciliation for the last year. And we're excited to have Lynn Sherman presenting this evening. We have found sharing information about experiences to find common ground is very helpful and important in this kind of dialogue. So I'm just going to go in and do the introduction. Ms. Sherman serves as the Director of Community Engagement at Baptist Health, where she leads community benefit initiatives that are designed to identify and address the unmet needs relative to health in the community and set priorities and develop strategies to improve health and quality of life for families where they live, work, and play. It includes providing community outreach programs with local faith-based organizations, nonprofit organizations, elderly advocacy organizations, community health literacy for health disparities, and she has worked in healthcare at Baptist Health for 41 years and holds a master's degree in healthcare administration. She also spends a lot of time working with youth, serving on boards, working with 90 Forward and other community groups. She was named one of Jacksonville Business Journal's Healthcare Heroes and Leadership Jacksonville Alum 2011, and selected by the Jacksonville Business Journal as an elite African American leader. And with that, I'll turn it over to Lynn to present to us background information on cancer and its impact on the Black population. Lynn?
Good evening, everyone. Thank you all. Thanks, Dennis. Thanks for that introduction. It's probably way more than anybody needs to hear. I think what's most important that he shared is that my name is Lynn Sherman, and I care about the community. And that will certainly encompass everything else that's been said. I work at Baptist Health, and healthcare is what I am passionate about, especially when it comes to healthcare disparities. I really appreciate the opportunity to talk to you about some of the areas of healthcare disparities that are in the forefront for me, and as it relates to screening for cancers in our community. And I want to tell you just a little bit about why that's so important for me. So take a look at these statistics. 224,000 new cancer cases and 73,000 cancer deaths are expected to occur among Black people in 2022. I don't know about you, but that's too many. That's way too many. Black people have the highest death rate and lowest survival of any racial ethnic group in the United States for cancers. Lung cancer actually leads in cancer deaths among Black men. During the most recent 5-year period, Black men had a 6% higher incident rate, but 19% higher mortality rate than white men overall. That shouldn't happen. That shouldn't be the case. Breast cancer leads in cancer deaths among Black women. And Black women are 41% more likely to die as a result of breast cancer than white women, despite the lower incidence rate of the disease. So we're not getting it more frequently than white women. We're just simply dying a lot more, 40% more than they are. I'm going to show you a graph, but I want you to not worry so much about how busy it is, but I just want you to take a look at this this graph, this lung cancer. The number of lung cancer is the number one killer in African-American men. Breast cancer recently surpassed lung cancer as the number one cancer killer of African-American women. And take a look at the blue line. which is Black men, and then the blue line, which is Black women for number of deaths. This one is a little busy too. The red is the African-American death rate and the blue is the white rate. African-American actually, again, surpasses the most cancer deaths in our country. So let's talk a little bit about breast cancer and how we can prevent this from happening. The only way we can is to diagnose cancer early and to get screened. At age 40 is when women should be screened on an annual basis. When you get screened, there's no order needed, no matter where you get your screening from. We'll talk about where some resources for getting mammograms in our community for those who are uninsured or underinsured. But in order to get a mammogram, no matter where you go, you need to have a primary care physician say that you can, so that they have someone to turn in those results to. And that's the only reason. Typically, insurance will cover 100% for a mammogram. So there's a new, not necessarily new so much as newly introduced to all of us, and I think it's a game changer. I think that every woman with breasts and every man with breasts should know about it. It's called the Fast Breast MRI. And I just recently learned about it myself. I'm actually scheduled to have one done tomorrow morning. How ironic is that? It's a 10-minute self-pay examination. It catches breast cancer early so that it can be cured, to avoid the harsh treatments of chemotherapy and radiation therapy. It's in addition to a mammogram. It's not instead of. I've had my mammogram already in October, but when I learned that I could also, or should also, have this fast breast MRI, I immediately called my physician and said, I need an order to get this done. And you'll find out why I felt like it was so critical for me in just a moment. It's not instead of a mammogram, it's in addition to a mammogram. And I know some of us get the 3D or the regular mammogram, and we believe that the 3D mammogram is going to take care of it all. It's going to allow us to see, or allow the radiologist to see everything that they need to see. So I learned that that's not the case, not always the case. Because when a woman has dense breasts, and you must have a mammogram in order to diagnose a dense breast, 3D or regular mammogram, there are small tumors that could be hiding behind the cloud that a radiologist may not be able to see with the naked eye when they're looking at the results of the mammogram. But by doing the fast breast MRI, there is no, it can't hide. It can't hide anywhere. So it is important, I think, for all of us to know that this test is available, and physicians aren't necessarily sharing it with their patients. And I've learned that they're not sharing it because it's not covered by insurance. But I also learned that it costs about, for self-pay, it costs about $300, anywhere from $300 to $400 right now. And I think if enough of us request it with our insurance company, then our insurance companies will eventually pay for it, like they have some other things, because of the pressure from the consumer. And so we just have to be our own advocate. And so that we can survive this issue, we have to speak up and say that this is what I need, this is what I want, this is what I'm having, which is certainly what I did. This is a lady that had her annual mammograms. She discovered a small lump in her breast years ago. And the one thing that tends to paralyze us sometimes as women is the fear of knowing what's really true, of the fear of just the idea that we might have breast cancer, because we've seen so many other people suffer with the results of it. And we say nothing, and we pray and we hope, and we pray and we cross our fingers and our feet and our legs, just hoping that it's not cancer and that it's something else. And then eventually we learn that it is cancer. And this lady on the screen that you see is my mother, Mildred Coleman, who died at age 51. She was diagnosed at 48, and her fears prevented her from telling anybody. And that was quite a few years ago. And things have changed now. And so you can see that because of her diagnosis, and she died with metastatic breast cancer, and because of her diagnosis, I am all over it in terms of finding out what's best. I have 4 sisters and 5 brothers, and so the cancer in our family is relatively high. My mother's sister also had breast cancer, but she didn't die with metastatic breast cancer. She's still living. She's about 88 years old now. But it does run rapid in our family. And so I'm very careful to share with friends and to share with family how important it is that we take care of ourselves and that we advocate for ourselves, because if we don't, then it is a disease that we won't survive. So let's just take a quick look at colorectal cancer. When it's found at an early stage, before it has spread, the survival rate is about 90%. Incredible. Only 40% of colorectal cancers are found at the early stage. That shouldn't be the case. That shouldn't be the case. We should do more screening. And we should, it's so important for us to learn what's going on with our bodies and get screening when it's time for us to get screened. I had a friend who last year we did a big campaign on colorectal cancer. And I had a friend to call me up in September, and he said to me, he said, you know, I did the Cologuard and it turned out negative and nothing was there. And because I heard you kept saying, get a colonoscopy, I decided, my wife pressured me, and I decided I'm just going to go ahead and get it because it, you know, I'm going to shut Lynn up and I'm going to shut up Tanya. So he had his colonoscopy done and he had 15 polyps. And the Cologuard didn't pick up those polyps. It's not designed to do that. Cologuard is really great, but it's not designed to do that. It is designed to pick up certain DNA. And he had 15 polyps that were removed that were precancerous when he had his colonoscopy done. So he called me to tell me that story, to say thank you for the campaign, because he needed to hear that. Now the age for colonoscopies have dropped 5 years to 45 years old. If you're 45, please get screened for colon cancer. Personal or family history of colon cancer, you should be screened no matter how old you are. If you're younger than that, advocate for yourself. Talk to your physician about getting it done, especially if you have a strong family history for it. Every 5 to 10 years, depending on the risks, and your primary care doctor can certainly order it if you want to have it. The options to screen for colon cancer is colonoscopy, as I mentioned. It's an at-home prep. Many people are not afraid, but just don't want to be bothered with the prep. And I'm a witness, and I know many of you on this call are witnesses, that it's a simple prep, and the procedure, you don't even remember anything about the procedure. It's so simple when you have it done. As I mentioned earlier, Cologuard is another option. It's an at-home test, and it's 90% effective in terms of picking up blood in your stool, but it will not pick up polyps or tell you whether or not you have polyps. And you also have to have that much more frequently than every 5 to 10 years. So get screened. For average risk individuals, at-home tests have been really okay and encouraged. And again, your physician can help you order the Cologuard if that's what you so choose to do, instead of getting a colonoscopy. Insurance pays 100% of your colonoscopy. One of the concerns with the Cologuard is if you do Cologuard, and it comes out that you have an issue, and it picks up some DNA or blood in your stool, then you will more than likely have to pay for what is a diagnostic colonoscopy, which could mean money out of your pocket, because it's not a screening anymore. You were screened with the Cologuard, and the doing the colonoscopy after the Cologuard is considered diagnostic at that point. We all remember uh, celebrities who have had colon cancer. One, Black Panther, and is one, and there are many others. And when I Googled the number of African Americans that died young with colorectal cancer, the number is endless. The names, the list are endless, and there are people that we know. And it's not always the famous people that we should consider, because sometimes we see them as being so far away from us, so far removed from who we are and where we are. And we don't realize that it's happening right around us, our neighbors, our friends, our relatives, even within our own families. It's we have people younger and younger dying with cancer unnecessarily. This young man that you see on the screen is his name is Wilbur Smith. Nickname was Will Smith. At age 43, he suffered from some abdominal discomfort. He went through that for about 2 years. He went to his doctor. His doctor was treating him for that discomfort. He's 43 years old. What could it be? Healthy, athletic, eat well, a healthy young man. Presented with bloody stools, then they finally did a colonoscopy. He was diagnosed with stage 3 colon cancer. This is my baby brother. His name is Wilbur. And so you can see why I am on a journey to encourage all of us to get screened. And not only to get screened, I'm on a journey to encourage all of us to advocate for ourselves and not take no for an answer if you believe that there is a reason to go a step further. This is a young man who was at the prime of his life, just serving as an administrator for a boarding school, had finished his law degree, raising a daughter. So right in the prime of his life, it was diagnosed with colorectal cancer. So unnecessary. And he's probably one of the nicest young men I know he was, and probably didn't push the doctor very much to do any more than what he was already planning to do, because that's just the person he was. We have to advocate for ourselves. And I'm sure that you can name people in your life that have died early from cancer, or not. Anytime you die from cancer, it's too early. Let's take a look at lung cancer. Lung cancer screening is necessary, and there's so many people who are unaware that there is an opportunity to get screened for lung cancer. In the past, by the time they find cancer in the lungs, it's really too late to do anything. And it's at a stage that there's not a whole lot that can be done. If you are a male or female between the age of 50 to 77, and you're asymptomatic, you don't have a cough, you don't have anything, you're a current smoker, cigarette smoker, or any kind of tobacco smoker, or you've quit, and you've quit less than 15 years ago, and you smoked, when you smoked more than 20 packs of cigarettes a year. Insurance covers this CT scan 100%. And this low dose CT scan is only $115 if you have it done now. If you know of anyone who meets that criteria, that age range, they've smoked, they quit smoking in less than 15 years, they have a 20-pack year history, encourage them to get the low dose CAT scan. It's not $115. The medication to treat cancer is going to cost more than that. So it is certainly something that we want to encourage people to do. Before low-dose CAT scans, physicians used to order chest x-rays. Unfortunately, small nodules were unable to be identified with this type of imaging. They couldn't see it. You can see how cloudy it is. And if it was a very small nodule, they really couldn't see it. So it was so important for us to take a look at what it looks like on a CT image. You can see the very smallest nodules by doing a CAT scan as opposed to doing a chest x-ray. Sometimes when we present with a cough, especially younger people and even people who do not smoke, for some reason, the incidence of lung cancer in Northeast Florida has skyrocketed for young folks as well as older folks and people who are not even smokers. So we have to listen to our bodies and we have to speak up and speak out. And every cough is not a sinus infection, and every cough may or may not be asthma. But getting a definitive diagnosis is the answer to doing that. So a CAT scan may be necessary, and a low-dose CAT scan is affordable for most of us. And I've even had a hospital administrator said if we had anybody who fit the criteria and came to the hospital and needed to have a low-dose CAT scan, we would do that at no cost, especially when it only costs $115. The fact is, many of us don't even know that it's available to us. The blue that you see, the blue line, is the percent of cancer patients prior to lung screening implementation. Only 20% were found in early stage. Now, if you take a look at the red, that's the percent of cancer patients after lung cancer screening implementation. Almost 70% were found in early stage, and the survival rate was much higher. This is the survival rate according to the stage. At stage 1, you can see that the survival rate is as high as 92%. If found at stage 4, which is at the bottom of the slide, the rate is much lower. This is what people often say. I haven't smoked in years. It's been 5 years, 10 years. I haven't smoked at all. Nobody in my family has ever had lung cancer. I don't have any symptoms at all. But guess what? You can still get lung cancer, and you should be screened if you meet the criteria. There are ways we can prevent this. We can certainly avoid tobacco and decrease our alcohol consumption. We can develop a healthy weight, and we all know what we must do to do that. Staying active throughout our lives. The American Heart Association recommends 150 minutes a week. We can all do that. And just eat a healthy diet. And I don't mean to sound like it's that simple when I say just eat a healthy diet, but eat a healthy diet can help prevent that. And tobacco does not care where it goes. And the cancer can be anywhere. It can be in your blood. It can be in your liver, in your stomach, in your kidneys as a result of smoking. Lung cancer is not the only cancer that is a result of cigarette smoke. So there are options. There are organizations out there to help you quit smoking. Some of them will provide free nicotine replacement therapy until you get used to the idea. And many people don't know that that's available at free of charge, at least 2 weeks of it, every 2 weeks. All you need to do is call when you're out and they will provide you more. The idea is that you're still getting the nicotine without the impact of the tobacco in your lungs, in your system. And then the goal is to eventually wean you off of the nicotine gum, which is a lot easier than weaning you off the cigarettes or whatever it is you smoke that is a tobacco-based thing. So AHEC has a great program where they provide nicotine replacement therapy, and it's useful and can help a lot of people and has helped a lot of people quit smoking, because we know that nicotine is one of the most addictive drugs there is. And it's not an easy thing to do. I spent many years being a smoking cessation facilitator or instructor, and I know how hard it is for folks to quit smoking, because I've watched them suffer. I've worked with patients with chronic lung disease, emphysema, and asthma, and giving up cigarettes. They were only able to give up cigarettes when they just simply couldn't breathe. So I know how difficult it is, and support is needed when you're asking folks to quit nicotine. Some people can quit cold turkey and not have any issues at all. So this young lady here was my mentee beginning in the 8th grade. We have a program at Baptist called Tipping the Scale, and I met her back in 2000, and she was a wonderful, bright young lady. She suffered from a light cough and just unusually tired about 3 or 4 years ago. It took months for her to get answers about what was going on with her, and why was she coughing so much, and why did she have this unusual fatigue. Although she was treated with a lot of asthma medicine, trial and error, just trying to try things that would help her eliminate the cough, and it's a thing in medicine that would give her energy. And after a few months, they finally did a CAT scan of her lung, and she was diagnosed with stage 4 adenocarcinoma, and at the age of 33. On January the 21st, 2022 at 11 a.m., I was sitting in the church at her funeral. She never smoked a day in her life. Be your own advocate. 15% of lung cancer is not caused by smoking at all. Be your own advocate. Advocate for someone in your sphere of influence. Talk to people. Someone tells you they're having these kind of symptoms, just encourage them to speak up for themselves and demand screenings that they need in order to do well, in order to survive. And if you're having GI issues, just request a colonoscopy. Don't sit on it and don't wait. Just request a colonoscopy. Guys, going inside, looking at what's going on is the best way to diagnose what's going on with you, and not go months and months and months continuing to say, I just don't feel good, or my stomach hurts, or I'm having cramps, I'm having bloating, I'm having just pain in my abdomen. Speak up, advocate for yourself, for sure. And for those folks who need to have resources for healthcare, Jack's Care Connect is it's a coalition of our federally qualified health centers, along with our free clinics, who are working together in an effort to care for people in our community. Anyone who is 250% below poverty, that's about $32,000 a year, or if they're uninsured, can get care at Jack's Care Connect. And a resource for free mammograms, the pink ribbon screening is here and live and kicking for the greater Jacksonville area. There is funding that will provide a free mammogram for women in our community, those who are uninsured. The only key is that they've got to have a doctor who will look at the results when the results are in. And Jack's Care Connect can take care of that part if a person does not have a physician already. But just because a woman does not have insurance should not be a reason why they don't get a mammogram when they need to have at least a basic or 3D, not a basic, but a 3D mammogram at the very least. There are free clinics everywhere. And if folks are on this call and they're from Nassau and Clay County, there are organizations that can certainly help facilitate care for you if you are uninsured or underinsured. Barnabas Clinic and Asa Health in Clay County, Barnabas Clinic in Nassau County can certainly help help folks who are uninsured get what they need. So that's what I wanted to share with you all today. And the theme of this discussion is get screened. Encourage the people in your sphere of influence to get screened. It's so critical that we do, and that we do it early, and that we don't sit on symptoms, signs and symptoms, and so that our community, the African American community, can be free of cancer, and the incidence of cancer won't be so great. So it really is up to us. Each one of us, everyone on this call, can advocate for getting screened for these cancers. And I would encourage you all to encourage everyone you know to get screened, and not to allow symptoms to just linger. Thank you very much for your time.
All right, thank you very much, Lynn, for sharing that. Very vital information, I'm sure. A couple things. One is many of us haven't heard those statistics, and it's very helpful. Probably most of the people on this call. And also the push you're giving us to get screened and deal with it is very helpful. But I'm going to go ahead and shut off the recording and let people just reflect and ask questions, whether it be about the science or just generally about Lynn's experience or others' experience. And I think Lynn has a couple of questions too that she wants to ask, but I'm going to go ahead and shut the recording off.